Especially as we get older, that we start to see more brown spots on our skin, and we just want to know, what should we do about that? Why are they, how are they being caused, and what can we do to stop them? As Dr. Michelle Pennie is here to talk to us more about that this morning. Of course, there's things that all of us would like to change about our skin, but this is a common problem.
Yes. I see this, common problem, common complaint about brown spots on the skin. And there are many different types of lesions that can cause brown spots. Some are just from sun damage. We call them solar lentigos, but they were sunspots. Sometimes they're benign growths on the skin, the little warty growths called seborrheic keratosis. Some people have melasma, and then of course we always worry about melanoma when we talk about brown spots.
Okay, so how do you know where yours fits in that scale?
Well, if it's a small brown spot, singular brown spot in the face area, you've had a lot of sun exposure, it's most likely what we call a sunspot or solar lentigo. But I always encourage, at least once a year to have a full skin exam, have that examined, because sometimes, innocent brown spot on the face is not an innocent brown spot. It really is a melanoma. So it should be checked. And then once it's checked, you can talk about treatment, what you can do about it.
Okay, and so if those are the sunspots that we usually see, what can we do about it? Is there anything we can do at home about it?
Yeah, certainly. There's a lot of skin lightening products on the market. They're called skin bleaching creams or skin lightening products. Some of them contain hydroquinone. That really is the gold standard skin lightening cream. Usually about 2% is the strength.
Okay.
But there are other products that also have skin lightening features if you don't want to use a hydroquinone product. So things with ascorbic acid, which is vitamin C, kojic acid, soy, or butane, those are all ingredients that help lighten those brown spots.
Okay, and is that something you should probably see your dermatologist about first before deciding which one is best for you?
Yeah. Well, certainly if you're just starting to get some brown spots, or maybe you have some melasma, you can start with some over-the-counter products and start with that and see if you see improvement. Also important is sun protection. Actually, sun protection alone can really fade brown spots.
Really? Okay.
So it needs to be UVA and UVB protection, and really should contain one of the physical blockers. So that's either titanium oxide or zinc oxide.
Okay, and then real quick, the last thing, what about in-office treatments?
In office, well, we have a lot more options, but usually a combination treatment. So the brown spots can either be treated with chemical peels or lasers, and then usually in combination with a skin regimen that's going to include some of those skin lightening products, hydroquinone, other skin lightening ingredients.
Okay, and as Dr. Pennie mentioned, always important to get that skin cancer checked, because you never know. It's very important, especially here in Florida. Thank you for being with us this morning.
Thank you so much.
And we'll be right back.